back. We have another pet health segment with Dr. Takeuchi, the co-medical director of Eastern Maine Emergency Veterinary out of Brewer. Thank you so much for coming in.
Thanks for having me again.
Absolutely. So we're just going to dive right in. Something that is not historically an issue in Maine has come to your attention at the clinic, heartworm disease. So what's something that pet owners need to know and just need to keep in mind about that?
Yeah, so historically we have not seen a large number of heartworm disease in Maine, especially if your dog is born and raised in Maine. We're not seeing it, but we actually had our first ever heartworm positive test at the emergency clinic. I have seen it in day practice, but never at the emergency clinic. And although this dog was not native to Maine, I did do a little bit of reaching out to colleagues. And in Cumberland County, so south of us, last year, one clinic saw 7 positive cases of born and raised in Maine dogs, never left the state. And so that means that a lot of our mosquitoes in the area are now carrying heartworm disease. It is a fatal disease if they get it. And even with treatment, you can have permanent cardiac as well as lung dysfunction. And there's literally worms in your heart that look like spaghetti. You don't want your dogs to have that. And mosquitoes can get into your house. Cats are able to contract heartworm disease, but they're not as susceptible. In the South, they do recommend heartworm treatment or prevention for cats. Here, it's still probably mild enough that the cat will be able to clear it, but in dogs, year-round heartworm treatment is now strongly recommended.
Wow, okay, so definitely look into that for prevention. Also, you've had rabid raccoon calls recently.
Yes, so we've had some calls saying that there was a raccoon in a neighborhood that was sent off, and there were some dogs in the neighborhood that were not up to date on rabies, so quarantine issues. It is a state law for public health reasons to keep your rabies up to date on all of your pets, including indoor cats. Usually every summer we get a phone call about an indoor cat who is not rabies updated, who caught a bat.
Oh, no.
And then it's a whole issue. A couple of summers ago, we had a family pick up a kitten on the side of the road, and that kitten ended up developing seizures in about 3 days from being picked up and ended up being rabies positive. So it is in the area. Our raccoons carry it. And like I said, every summer we have that one family that calls to say, my cat just caught a bat, what do I do? Also,
we have been seeing plenty of bugs out, the mosquitoes, the black flies, the ticks, and some people have mistaken certain bites. And it's easy to do. So just explain some of the bites you've been seeing.
So since most of our animals are covered in fur, you will notice bites on their belly, ears, and like in the groin area where the fur is thinner. And black fly bites often look like target lesions that we think of in people for tick bites, and those are black fly bites. They usually do not indicate tick bites. Animals that have tick bites, sometimes it'll look more like a pimple or a whitehead and more reactive. So if you see that kind of bruised look on your dog, that's probably a black fly bite. We are also seeing some severe mosquito bite hypersensitivity where a cat will get bitten on the nose or the ear, and it can turn into almost like an open wound or ulcer. They can be really, really allergic to those. So if you suddenly see that your cat's nose or ears are really ulcerated, definitely get veterinary care, but it may be something as simple as a mosquito bite hypersensitivity.
Wow, yeah, I've definitely seen a couple of those on Simba, so that's good to keep in mind. If you want to contact the clinic, you can find that link on our website, or you can give them a call at 207-989-6267. I thank you so much for coming.
Thanks for having me again.